This is a pig's heart, anterior and posterior. This is what we call pericardium. A pericardium closes our heart and creates vessels. In this part called myocardium, it is the muscle of our heart. In addition, myocardium mostly located at the two chambers of our heart, which called ventricles. In this part, it's called apex, or it's called the base of our heart. We have also four chambers of our heart, which are the right side and the left side. In the right side, we have the right atria. The right atrium is the first chamber of our heart that the blood comes into contact, which it returns the blood systemic circulation and from the blood supply to the heart. And this part we call it right ventricles, the lower part of the right atria. The right ventricle pumps blood low in oxygen to the lungs. So let's proceed to the left side. This is what we call the left atrium. The left atrium receives oxygen-rich blood from the lungs and pump into the left ventricle. In this lower part, the left ventricle. The left ventricle is the main chamber of the heart. It is responsible for pumping oxygen-rich blood into the aorta. And that is the fourth chamber of our heart. The pulmonary artery. These blood vessels branches and carry blood to the lungs to receive an oxygen and can be found curving part of the right ventricle or upper chamber to the left. Aorta, a major vessel located near the right atria and just behind the pulmonary artery to the lungs. Located the curved part of the vessels known as the aortic arch. Branches from the aortic arch is a large artery that supplies blood to the upper body. Inferior and superior vena cava. These two blood vessels located on the left of the heart and connect to the right atrium or on the upper chamber on the left. Coronary artery. These blood vessels lies on the grow on the front of a heart and it branches over in front and the back side of the heart, as cutting the pulmonary artery and continue cutting around into the wall of the right ventricle. The cutting should be parallel or above the groove of the coronary artery. Use the hand to open it to examine the structure. So it is the right atrium. It notice the tiny muscles wall of the receiving chamber. The valve between the right atrium and the left ventricle is what we call tricuspid valve. This valve allows flow from the right atrium into the right ventricle during diastole. When the heart begins to contract, ventricular pressure increases until it the greater than the pressure of atrium, causing the tricuspid to stop flow. This is what we call septum. This takes a muscular wall to separate the right and left pumping ventricles from each other. There is one-way valve called the pulmonary valve. It controls blood flows away from the right ventricle at the entrance of the blood vessels, as opening the heart at the right atrium downward to the right ventricle, cutting toward to the apex and septum at the center groove. Examine the part of the right atrium, find the opening of the pulmonary veins from the lungs, and observe the one-way semilunar valve at the center to these veins. Inside this chamber, look the valve control the blood flows between the upper left atrium and the lower left ventricle. This valve called the bicuspid valve. This is the left ventricle. Notice the thickness of the ventricular wall. The heart chamber is responsible for pumping blood throughout the body. As the left ventricle and the aorta cut, it exposed the valve. Count the 3 pulps on these valves leading from the left ventricle into the aorta, and it have the moon shape. This is called the aortic valve. As it cut, examine the inside, find the valve or the coronary sinus of this major artery. It leads to coronary artery, which is carry blood to the nearest heart and muscle itself. And that is my pig's heart dissection. Salamat sa panonood! Bye-bye!